Well, good evening, everybody. Let's go ahead and get started with tonight's virtual family engagement session where we're going to talk about our district's safe transition to blended learning. Thank you, everyone, for being here tonight. Before we get going, let me just remind you, go ahead and turn your microphones off. We want to be able to hear all the presentations tonight without any background noise. Your microphone's off, but I still want to hear from you. So please put your questions, your thoughts, your concerns in the chat. We will have people monitoring those. We use the chat not only to insight for this meeting, but also to provide some context on what future virtual family engagement sessions might be about if we see a lot of questions. So make sure to put your thoughts and concerns in the chat. Also, go ahead and turn your video off. We just want to minimize the bandwidth. Imagine a computer trying to run all those different little video screens. So feel free to turn your video off. And I really appreciate all of you being here. My name is Scott Varner. I'm the Executive Director of Partnerships and Family Engagement here in our Department of Engagement in Columbus City Schools. And we began these virtual family engagement sessions several months ago because we believed in the importance of having a conversation, making sure that as we knew information, as questions, concerns arise, we were able to talk to our families, talk to our staff about those concerns. We don't have all of the answers, and as you know, what we've come to learn most in this crisis is that things change quite often, sometimes quite frequently. So an answer today may be different a week from now, but it was important to have the conversation so that we were all involved, and then we can share what information we know. Information that we share with you can be shared across our community. So I appreciate you being here. I also am going to ask a favor of you, something that we've called helping exercise a little bit of grace. That is, we're committed to giving everyone the opportunity to voice their opinion. That's why that chat is so important. Please, I invite you to put questions and concerns in there. But help us to remain positive, always being considerate of others' feelings and monitoring our tone. We know that this is a time of anxiety for a lot of us, a time of stress because there's been so much change. We as a district have asked so much of you as parents, and so we know it's stressful. So help us try to be positive and watch our tones, considering others' feelings, because friends, like it says there, we're all in this together. It's about everyone, and we want to make sure that we are most helpful to you, and we all kind of exercise a bit of grace during this time of stress. So let's get started in talking about our blended learning plan. This is our website. I hope that you have had an opportunity to go onto our website because it is containing information each day that's updated as new information comes. So I hope you take an opportunity as often as possible to go to our website and go to the reopening section. I've circled it on the screen because it's such an important section. In that section, you will see tabs of information on the left, bunches of different topics, everything from information about our Fuel Up food program on Wednesdays, our COVID-19 dashboard, which we'll hear a little bit about later as part of this session. You'll see information about our blended learning plan, technology. And right in the middle of the screen, the other arrow points to our blended learning hub. That is, we are making sure as information becomes available about kind of this safe transition to blended learning that we're putting information on our website. We've created these different categories and boxes. And part of what I want to try to do tonight as part of this session is go through these pieces, try to answer your questions, share with you the updates that came out this week from Dr. Dixon. Now, again, let me reiterate, we don't have answers to every question. And I'm seeing a few questions already coming up in the chat that we just don't have all of the answers right now. But again, I want to make sure that you have as much information as possible. You hear kind of where the district stands at this point. We can take your questions. Those are what we make sure to share with our superintendent and others so that they know these are the questions that are pressing on our parents' minds. These are the questions that they want to hear answers for. and so that we can share those with you as they become available. Again, this Blended Learning Hub has such great information. Let me share a couple of important updates. So this is an important update that you'll be seeing probably. You may have even gotten an auto dial message here right as we began our session, reminding families that our teachers are returning to the classroom for the next couple of days. As they are returning this Wednesday and Thursday, that means students will only have the asynchronous learning. That means no live sessions with our teachers for this Wednesday and Thursday for the majority of our students. Now, that doesn't mean that students have the day off. They've been given assignments to work on Wednesday and Thursday. So students still need to complete those assignments. But again, it'll be asynchronous, which means there isn't the set schedule. Students can work on those assignments at the time they want to work on them, or at the time that you as a parent tell them to work on them. Won't be a class right at 10 o'clock like you've had maybe during other days. So asynchronous learning only for Wednesday and Thursday. If you have questions, email your teacher. And I think many of you have probably been emailing your teachers during this time. But again, asynchronous learning, no live sessions with the teacher for Wednesday and Thursday. And as you may know, Friday is actually a professional development day. It would have been a day where there were no classes at all. So Friday will be a day off for our students with no classes, but Wednesday and Thursday, synchronous learning. So what did Dr. Dixon, our superintendent, share with all of us earlier this week? She reminded us that we know that families still have a lot of questions and concerns, a lot of anxiety about what this move to blended learning looks like. So we've updated our plan, and it now includes virtual or in-person individual orientation sessions, optional for our families in pre-K through 8th grade, those that would be moving into the blended learning model. An opportunity for families to have an opportunity to meet virtually or in person with their teacher to understand the safety protocols that have been put in place. I kind of think of these kind of like parent-teacher conferences, but parent-teacher conferences that are focused specifically on those health and safety protocols. So during these orientation sessions, and again, let me stress, they are optional, but students and families will meet with their teachers and any appropriate school staff to really learn about the safety protocols that are in place, what the expectations will be of our young people, and then we'll also be able to check in on if there's any technology assistance that's needed. And again, families may work through these sessions virtually and then decide that they may want to come in and check on the school again before they get started, but there'll be 15-minute increments. So again, kind of a quick 15-minute parent-teacher conference where we're focused on those health and safety protocols that give you the better sense of what the school day is going to be like for your young person and what protocols we've put in place to keep them safe. That also meant that we moved the start date for that blended learning. So we have delayed the start date for that blended learning. So you see on the screen now, updated information. Again, you should have received this from Dr. Dixon on yesterday. But as you see, for our students in pre-K through 3rd grade, along with those students that were identified as complex needs by our special education department, and those families probably have been contacted directly, their orientation sessions will begin Monday, and we'll have 2 weeks of those orientation sessions. And then those students would return to the classroom starting on that week of November 2nd. That's when we'll divide them up into those 2 cohorts, Monday, Tuesday, or Thursday, Friday group, and I'll explain that more in just a minute. But that's what you can see. So we have delayed the start of that in-person blended learning model to provide these orientation sessions. Now, again, you'll remember there were some other groups that were also starting back. So our career tech students, those students who are at Fort Hays in the Career Tech Center and at our downtown high school, Again, we delayed their start. We're going to provide a week of opportunity for families to do the orientation sessions if they want. And then those students would start back that week of October 26th. Students in grades 4th and 5th grade, as well as other students with those complex needs, again, as identified by our special education department, they'll be contacted directly by our special education department. They will have their orientation sessions that week of October 26th. Great opportunity there, and then start back with the in-person classes that first week of November as well. Then we move on to the middle schools, those grades 6 through 8, in which, and again, another week of opportunity for those orientation sessions, and then starting back the week of November 9th. High school students, that is still to be determined. And we're working through those options. Dr. Dixon has said often, we want to make sure that we are doing this safe and that we're doing it right. And this will be a transition to a blended model. So before we make any concrete decisions on high school, we're going to do this phased in approach. Learn what we need to learn from this beginning part, and then we'll look at the high school, because I think we all know high school is a lot different in terms of how students are moving about, interacting with each other across a building. You know, in an elementary classroom, typically elementary students spend their day in one classroom with maybe teachers or staff coming in and out. It's much easier to keep a group of younger students together than it is in a high school where, you know, high school students are changing classes every period, interacting with different teachers and classmates throughout the day. And so that just adds a little more complexity to our efforts. So that's why it's still to be determined. This is an important calendar. You'll find this calendar on our website, and again in the email that you received Friday from Dr. Dixon. Before we go further, I want to touch upon some other elements of that blended learning portal that were out there. And then we're going to get some in-depth presentations from our health services team, as well as our transportation team. I've asked both of them to really share with you some deeper insight into the health protocols and safety protocols that we put in place. And I think that will answer, as I kind of glance at some of the questions that I'm seeing, they will give you a little more information, some in-depth information from our health team and our transportation team. Then I've also asked someone from our pre-K, our pre-kindergarten team, to share with you a little more insight on pre-K. And I will tell you, I'm really excited when I hear about what's going in our pre-K program with our remote learners, because I'm sure most of us can't imagine how do you engage 4-year-olds in remote learning in pre-kindergarten, but they are doing an amazing job. So we'll hear a little bit more from them. But let me go through these couple other areas that are in the portal. So questions about why are we still moving towards a blended model? Well, again, Dr. Dixon, our leadership team, and our health team have been in close conversations with Columbus Public Health, boy, for the last 9 months as this pandemic moved into Central Ohio, and as the numbers have fluctuated in the spring, the summer, and now into the fall. You know that Columbus Public Health advised all of the school districts within our area that the positivity rate had gotten to a level in which they felt it was safe to bring students back in that blended learning format. But there's a caveat to that. We know that we don't know what the future holds. That late fall and winter, that data, those numbers could change, especially as we think about flu season. So we are in constant contact with Columbus Public Health, and what you see on the screen is something that Dr. Dixon has made very clear. We will not hesitate to close schools to go back to that fully remote environment if that is the direction or instruction of Columbus Public Health, that we start to see numbers moving in the wrong direction. But I hope that you will take an opportunity. Dr. Mashika Roberts, the head of Columbus Public Health, spoke with our board just this past week, shared some incredible information and insight into kind of the numbers, because we all know that the numbers were very different in our boundaries within Columbus, in the neighborhoods and communities that make up Columbus City Schools, different from our suburbs, different from the rest of Franklin County, rest of the state even. And so we're looking very closely at those numbers within our boundaries, recognizing that there are impacts on what happens around us. We don't live in a bubble, but we want to be very concentrated on what's going on in our families' homes. And so I've put the website on there, and we'll make sure to put that information in the chat so you can go to that COVID-19 portal that the city's created and see some of the updated numbers. I talked a little bit about, when we moved to that blended model, we've tried to divide the district up into two cohorts, two groups, a cohort A and a cohort B. What that really means is there's a group of young people who are Monday, Tuesday kids, as I call them. They will attend in-person classes on Mondays and Tuesdays. Then we have our Thursday, Friday group, students who will attend classes on Thursday, Friday. When you're not in person, you will be asked to work remotely, very similar to what you're doing now. And all students will be learning virtually on Wednesdays. Now, I think I saw a question come through, so it's good I put this on here. Somebody's asked, well, what if I start as one cohort but want to move to the other? Maybe start Monday, Tuesday, but want to go to Thursday, Friday. Unfortunately, we can't change it at this point. Those assignments are being made so that we can keep that balance to our class sizes, so that we can allow for the social distancing, the health protocols that you're going to hear about in just a minute. So we will not be able to adjust those cohorts at this point. And that really just aligns with the safety and health protocols that we put in place with our health services team and in partnership with Columbus Public Health. How do you find out which cohort your child is? Log into Parent Portal. And if you still have questions about how to get into Parent Portal, again, go to our website. There is a great tutorial on how to access the Parent Portal. And if you've forgotten your login or haven't gotten a login, it shows you how to get one very quickly. Let me touch on another area, Chromebooks and technology. So thanks to federal dollars that we received as part of the CARES Act, we were able to purchase more Chromebooks so that as much as possible, every student who needed a Chromebook has one at home. When you come to school on those in-person days, we need you to bring that Chromebook with you. We need those young people to bring their Chromebooks. We have testing that will need to be done, assignments that will need to be done in class. So those students should be bringing their Chromebook with them. And we need to make sure they plug them in the night before. Hopefully they're doing that already. So parents, I'm going to ask for your help. Please help us remind those young people to bring their Chromebook with them when they come to school on those 2 in-person days. Breakfast and lunch. I think this is important. Again, we have asked so much of our families during this time, and it's rewarding to see that at least one burden, that burden of grocery shopping, making sure that there's healthy food available for your child, is something that we can at least help with a little bit more. When students return for their blended learning on those 2 days, they will receive breakfast and lunch, again, still at no cost, as we always have done. And it will be more of that traditional breakfast and lunch that you're used to. When students leave on that second day, so after their Monday, Tuesday, or after their Thursday, Friday, at the end of that school day, we'll be giving them their meal kit to take home to cover the rest of the week. So we will still be making sure to send food home with young people. As you can see on the screen here, breakfast will be kind of very, very much a grab and go style. We want young people to be able to come in, grab it, go to the appropriate place, whether it be the classroom or another location within the building, so they can maintain that space, that social distancing. The cafeteria is not going to be like it used to be with everyone crowded around. Same for lunch. Students will choose their meal bundle and then be able to take it to a space where they will be socially distanced. This is all in the name of safety, speed, and convenience. We want to make it easy for kids to get their meals, but also make it fast and safe. So again, an important note. So tomorrow night, Wednesday night, is still our normal Fuel Up food distribution. So that location that's closest to your house, make sure to stop by either at lunch between 11 and 1 or in the evening between 5 and 7 to pick up your 5-day meal kit. This is then the transition once young people start to go back to that blended model. Don't forget about our learning extension centers. That's also one of the tabs in that area on our blended learning platform. a reminder about learning extension centers. These are these safe, adult supervised locations that many of our community partners have set up, free opportunities for families to have a space where they can feel comfortable that their child can be to do remote learning during the day. And in many of these places, they also get lunch, some after school type activities, and additional support. So if you are interested in trying to find a learning extension center near you, again, go to our website. We actually have an interactive map. You type in your home address and it will tell you what learning extension centers are around you. Now, let's get into the two areas that I think so many of your questions are linked to, and that's about transportation and also about health and safety. Let me reiterate something that Dr. Dixon has repeatedly said. The health and safety of our students and their families, all of our employees, and the community as a whole will always be a top priority. The decisions that are being made are in close consultation with Columbus Public Health, with our health services team. We've been working on these protocols together to help prepare for that return. That includes everyone wearing masks, social distancing, the physical changes that need to be made at our buildings to make sure that young people are as safe as possible, that we're following those guidelines. And I just have to say that our Office of Health, Family, and Community Services, those team of school nurses that are assigned to every building across our city, they are truly dedicated to making sure that we have a plan that is safe and that they are there to support our students and families. And with that, I'm going to introduce Dr. Amy Hotler, who helps lead that team. And she will share more about some of the protocols that they've put in place, answer a lot of your questions that you have about what will happen as we limit exposure and the concerns that are raised. So with that, Dr. Amy, I'll hand it off to you.
Thank you, Scott. So we know that this plan has taken a whole team approach. So we've been working with, Scott said, Columbus Public Health. We've been working with our custodial staff, our nurses, our secretaries, just a whole group of people. And so we really need your help to make this work. So I'm going to talk to you about 3 areas: mitigation procedures, public health responses, and then things you can do to help. So to start with, mitigation procedures are these strategies that we're putting in place to prevent the spread of COVID-19. And we'll start with hand washing. This seems like the simplest thing. We really have beefed this up. So we are making sure we have plenty of soap and water and paper towels available as usual. But in addition, we're adding hand sanitizer stations in several areas around the building, one at the entrance to the buildings, several around classroom areas, so that we have plenty of hand sanitizer always in reach. We are wanting students to wash hands at the start of school, before eating, after restroom use, before and after recess, at the end of the day, after cough and sneezes, and of course, when their hands are dirty. Also, we are requiring masks. So cloth masks, disposable masks, both are okay. They are required for staff and students. And it's very important to work with your students on getting used to wearing those if they're not already. So you can start out having them wear it for just a few minutes at a time, and then gradually increase that time if they're not used to wearing those already. The mask must cover the nose and the mouth, and we're going to be watching for that. I see a lot of masks just covering mouths with noses hanging out, and that COVID virus can escape through the nose as much as the mouth. We will provide staff and with masks and students if they need them. So you can wear your own mask from home. If you don't have that, we will provide that for you. Another important piece is the social distancing. So 6 feet is important. And I can tell you from working with essential staff over the summer that when people have followed those guidelines, staying 6 feet apart, we are not seeing exposure in the work setting. When we see problems, or when people decide that they want to congregate together, and kind of reach that 6 feet area. So that distancing is very important. And we're going to help people by providing signage for reminders. We will have physical barriers installed where it's difficult to maintain a 6-foot space. Also, we are looking at classroom configurations and how we arrange tables and chairs and desks to promote that 6 feet distance. Also, we are looking at respiratory etiquette, and this is something that school nurses teach students all throughout the year when we're not in a pandemic. And some of your children may have taught you how to do the sneeze or the cough in the elbow. So we'll be really emphasizing that and washing and sanitizing hands after coughs and sneezes. If your child has a particular health condition like asthma, sickle cell, seizure disorder, diabetes, or any other chronic diseases or health concerns, you'll want to talk to your healthcare provider to find out if there's anything that your school nurse needs to know to make your child more successful in the school setting. And then public health. So we have followed guidelines from Centers for Disease Control and Prevention, Ohio Department of Health, and Columbus Public Health. And our school nurses are also experts in public health. We meet with Columbus Public Health several times a week. We have a more formalized meeting once a week just to review data, to ask questions that we might have, or maybe we need clarity about a certain way we want to implement something. And they have been excellent partners with us to help us make sure that we have our environment set up as safe as possible. Our school nurses are experts in communicable disease and public health, and each building will have a school nurse assigned that will be responsible for making sure all the staff is educated on the proper social distancing measures and masks, that they are knowing how to track illnesses, and then the nurse will be watching that data and help with contact tracing, in addition to all the other duties that the school nurse performs as far as program planning for the school and state mandated screenings and things. Health, Family, and Community Services Office, we will communicate and collaborate with Columbus Public Health to implement health and safety measures and just keep up what's going on in our local communities. So what happens if my student is ill? This is very important. If your child has any symptoms at all, we ask that you check them before they leave in the morning. And any symptoms, sometimes you think maybe it's a tummy ache and they'll feel better in a little while, or maybe they've got the sniffles. Any symptoms like this could be potentially COVID symptoms. So you want to watch for fever or chills, cough, shortness of breath, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, diarrhea, nausea, vomiting, congestion, and runny nose. If there are any of these symptoms, you want to keep them at home. So you might send your child to school, and then while they're at school, they may develop symptoms. So we have a process in place for this. If any students develop any COVID-19 symptoms, we have designated a separation room in every building where children will go if they have symptoms. We want to make sure that those children are picked up in a timely manner. So we will call parents. We ask that you pick your children up within 30 minutes if possible. And this is where it's really important to have a couple of backups to help you with transportation. We may call you one day and you may not be able to get there in 30 minutes. And you might want to call the next person on your list and see if they can pick up the child for you. So have a plan in place, just like you would prepare for a snow day. You want to make sure that somebody's always available. So we will be checking for symptoms of COVID-19. We will call you to pick up the child if symptoms are present, and then we'll help you decide what to do next. So this is another area where we work with Columbus Public Health. It might be that you need to stay home for a certain number of days, and we'll help you figure out if we send your child home, when it's going to be okay for them to return. So another common question is, what are we going to do if someone at school tests positive for COVID-19? And this is another area where we work really closely with Columbus Public Health. So we will, the first thing we will do is look for possible exposures. And we know that the definition of an exposure is being within 6 feet of a person diagnosed with COVID-19 for 15 minutes. And so we are going to be looking for all of the people that might be involved, whether it's staff or other students. And then those people will be asked to quarantine for 14 days. So we will follow the guidelines that Columbus Public Health provides us, along with the CDC and ODH. We'll notify you, and then we'll give you directions. In the case of if your child is positive for COVID-19, not only will the school nurse in the school building be communicating with you, but Columbus Public Health will be in touch too, and they will do additional contact tracing outside the school building for anybody that your child may have been in close contact with in the community. So there's a lot of different contact tracing going on in the case of a positive result. And so what can you do to help? First is keep your child home if they are sick, and then notify the school if your child is exposed to someone with COVID-19 or if your child tests positive for COVID-19. This helps us control the spread by intervening immediately to find out anybody who may have been exposed so that we can notify people in the event. And then we also have Scott mentioned a dashboard where we're going to be keeping track of positive cases in our district once we get back to in-person learning. So that's another place where you can kind of get the pulse of what's happening. We will be notifying if there's a positive case in your child's cohort, and by cohort I mean the people that they are with for the most time during the day. All those people will be notified of that case, and the building will be notified of a positive case. If you get a notification that there's a positive case in your child's building, it does not mean that you're exposed, because remember, you need to have close contact with that person in order to have an exposure. But the governor's office has asked us to report these. So I just want you to know that if you get a notification, exposure, that will be a separate notification. So it might be that you get a notification that there's a case in your building and not hear anything else. But if your child was exposed to a staff member or a student that tests positive, you will be notified directly of that exposure, and then we'll explain to you how to proceed with that. So the next thing you can do is keep asking questions. So your school nurse is an excellent resource on COVID and can help you to sort out a lot of the confusion around this pandemic. So don't be afraid to reach out to your school nurse. And I want to thank you for your attention, and keep taking care of yourselves. I know this is a very stressful time, and it's scary to think about returning to school. And I know changes happen so quickly, and we just know that we are watching the data closely and making decisions with the help of Columbus Public Health.
Almost forgot to unmute myself as I was. Thank you very much, Dr. Amy, for sharing that information. Again, I appreciate the work of the team. I know that our school nurses, we ask a lot of them, and this is an additional ask to really monitor, but I also know that the team you've put in place to make sure that that we have adequate staffing to monitor the situation, adequate training across our district. So I know that even I will be attending some mandatory training on our health and safety protocols. So every staff member is getting that additional training so that we as a staff are best capable to address some of these issues as they come up. Making sure that we have a nurse assigned to every building is very important. Because that assignment then allows for to make sure that those health protocols are being put in place, that there are questions that can be answered. So I really appreciate that. I want to take a moment to answer a few of the questions in the chat. I know there are some very specific ones that we simply just don't have the answers to yet in terms of some of the particulars about what the school day will look like. about some of the conversations about maybe changing some start times. Again, these are things that the district is looking at, considering, but no definitive decisions have been made. But let me answer a few things. So someone asked about our Fuel Up program, the food distribution on Wednesdays. Yes, that will continue. Families will still be able to access that, especially our high school families, and many of our students, the 3,000 plus who are part of our digital academy will still be able to access that. So our Fuel Up Wednesdays will continue. They'll just look a lot different. And again, remember, the part of that is to be as convenient as possible for parents. Again, we've asked so much of our parents. We're trying not to create a situation where you have to ask them to do more. So that's why we're trying to make it easier. If that young person can take that box of food with them as they leave the second day and take it home on the bus, that's going to make it a lot easier. Chromebooks. I think there were a lot of questions about Chromebooks. Please know that as long as it's charged up, they don't need to bring the cords with them, but we really need to make sure those Chromebooks are charged up so that they can do their work in the classroom. And then there's been a lot of questions in the chat or a lot of comments about working with all teams. You know that part of the decision-making process that our superintendent is working on involves working very closely with our labor unions. And we appreciate that they have all been working together to make sure, again, the priority being safety, making sure we're doing it safe and doing it right. And so I know that Dr. Dixon has shared her appreciation that we're all working together on this. And it has involved teams from all across the district. You know, when I shared with you that section of the website, you will see answers that come from every part of our district, from our health and safety teams, from our academic teams and curriculum, from our operations, our buildings and grounds. And it also comes from our transportation team. And that's the next area. I know there's been a lot of questions, thoughts about what will transportation look like. And so I'm going to turn it over to Rob Weinheimer, who is a member of our transportation team, who's going to kind of walk us through what transportation will look like. What are going to be some of those health and safety protocols that we'll need to think about when it comes to transportation. So Rob, please share with us the information you have.
Thank you, Scott. Thank you, Amy, for your presentation as well. Again, my name is Rob Weinheimer, an operations manager at the Office of Transportation. Just some quick facts. On a typical day, on a typical year, we will travel 70,000 miles per day just to deliver our kids to and from school, not including field trips or academic trips. We usually consume about 9,000 gallons of diesel fuel per day, and we serve 110 Columbus City school buildings and 125 charter non-public buildings. And any given week, we'll have about 900 employees in our department. So you can imagine we have a lot of moving parts, and there's a lot going on in the world of transportation. So I want to begin this presentation with thanking you for being here, and it's an absolute honor to give this presentation tonight. Your bus driver is very, very important to us. That's the most important piece to operating the school bus is your driver. If we don't have drivers, we can't bring your children in or take your children home from school. So we've made some drastic changes at our bus compounds. There's 5 unique compounds throughout the district, and we have the break rooms taped off so there's a single file line. They'll walk in, they'll clock in, they'll walk through, they'll check their mailbox. The supervisor will communicate if they have to, and they'll get right back outside, spending less than 5 minutes in the building, and they're pre-tripping their bus and getting ready. So the bus driver is going to come to the bus stop, and there's a few things we ask that our families are aware of. And Scott, if you don't mind, the next slide. I'm not going to read all of this, but I will just bullet point some of the more important things. And I'll tell you a story and I'll let you guys read what's on the screen. So the bus driver pulls up to the bus stop, and we asked before you send your kiddo out to the bus stop that the families do a health assessment of their children. So back to Amy's presentation, we're going to look for symptoms. We're going to look for temperature. We're going to look for certain telltale signs of a potential, COVID. So we ask that you do the health assessment at home. If that all checks out, send your kiddo out to the bus stop, and we ask that they socially distance at the bus stop, practice all of the guidelines that have been set forth by our health department, wear a mask. And once the bus gets there, the driver will open the door. The children will get on the bus. There will be touchless hand sanitizer dispensers on the bus ready for them. So when they get on, they can get a squirt of hand sanitizer either from the touchless. If that's not working, we'll have backup pumps ready to go so the kiddos can get some hand sanitizer. And we are going to load the bus from back to front. So seating is going to be based on where you live on the route. So if you're the first stop, the kiddo will get on and go to the back. Then we're going to seat them one per seat, but we're going to put them in a zigzag fashion on the inside of the bus. And I'll show more of that on the next slide. But for the story, I want to continue. We'll keep driving the route. We'll keep picking up the kiddos, loading them on. Then when we get to the school, we're going to unload the bus from the front to back. So we're really limiting cross exposure. Once the driver has unloaded all their kids, they're going to do their child check, make sure there's no kids sleeping. And then they're also going to do a quick disinfect of the bus. So our drivers have been equipped with spray bottles and a medical grade disinfectant. So in between each run, our drivers will spray down the entirety of the school bus, all the high touch points, and we're going to let this agent or this solution dwell, meaning sit on the surfaces for 10 minutes and dry. And the agent will do its work like it's supposed to and kill many germs, including the COVID germ. So we're doing that in between runs. When we get back to the compound, the bus will go through a much deeper disinfecting by our disinfecting crews. And we have about 15 per compound per people putting on backpacks and going through and spraying down with electrostatic guns, sprayers that release a very fine mist across the whole bus. So that is what your bus and bus driver are going through. And I'm just running through here real quick to see if I may have missed any important changes. So the bus will look very similar, but what we ask of you and your child and the bus driver are going to be a little bit different. Seating charts are going to be more important now than ever. It's a pretty typical process. We need to keep seating charts for sub drivers, for discipline reasons, so on and so forth. But now with COVID, our drivers are being retrained on seating charts just so we can really hone in on who is where and what time they load for tracing purposes. So Scott, next slide, please. Okay, and here's a diagram of the seating chart. So we are working with our printing department to come up with stickers that say sit here. We want to be very clear that kids know where to sit. So as you can see, the arrow shows that the kiddos get on the bus, they go by the driver. If the bus has an aide, that's where they'll sit, was in that first seat behind the driver. And you can see how we're going to zigzag them in their seats to really make that separation the best we can. So we're going to put up to 20 kids per bus because our buses are equipped with 20 seats. They're actually equipped with 21, but we're going to keep one open for the aide and any extra riders that may pop up at the bus stop, because our goal is still to get our kids to school, but we want to do it in the safest manner possible. So you can see on the reverse of this, the arrow will go the other way and the kids will unload from the front to back. Next slide, please. And here is an idea of the equipment that we're using and give you a visual of what is happening on the school bus in between runs or when they get back to the bus compound. So we really want to reemphasize that our buses are being disinfected multiple times a day. Like I said, in between each run, that could be up to 3 times in the AM, once when they get back to the bus compound, and again in the afternoon, up to 3 times and when they return back to the compound. So we are not taking this lightly, and we're absolutely doing everything we can to make this work. Not to forget to mention, our transportation team has been really diligently working on all aspects of transportation, routing, disinfecting, reducing the congregation of children. And one of the biggest things we've done is joined a lot of task forces with our peers across the state and even across the country. So we're really trying to pour in the best of what we've learned into our Columbus City Schools operation for your child's benefit. So the picture to the left it looks like a slime gun or a super soaker. That's actually a electrostatic sprayer, and the solution will go in the clear container, and that sprays a very fine mist that dries really quickly, but it distributes the cleaning agent in a very effective way where it will disinfect. And then the picture on the right is the backpack model, so you can see what we're working with. So next slide, please. And communication, we really rely on good communication to our parents, and now more than ever do we rely on that. And this is the type of form that we're going to send home to all of our families. So you can see this is just a skeleton version, but you can see that, you know, it's going to be the basics, the student name, assigned school. But what's different this year is you'll see your cohort on your transportation information, you'll see your times, and you'll see your assigned school days. So if you're in cohort A, just for example, I'm in transportation, not academics, so I may be a little off here, but cohort A is going to be Monday, Tuesday. Cohort B is going to be Thursday, Friday. And then if you have any other arrangements, that will be indicated there. Below, you'll see transportation. Underneath the transportation line, you'll see the assigned bus number, then the bus pickup number. And if it's different on the way home, we'll provide that as well. And then underneath that, you'll even see an additional day of the week visual diagram to show what days and what numbers those buses will be showing up. So Scott, that is all I have from the transportation presentation. But I will reiterate that a lot of what Amy gave from the building standpoint carries over into the buses. And we have been working diligently in the transportation office to make everyone as safe as we possibly can. So again, thank you for this opportunity. It has been an honor to present to you tonight. And I hope you all have a very good evening. Thank you, Scott.
No, thank you. First off, I do need to say that one of our participants tonight, Lisa Evans, you get the prize. Rob used a capture of one of the early designs of that mailer that would be going out, where you're right, the word information was misspelled. So please know that we did catch that before it's going out. And what we're going to try to do, again, we know that there's so much information that's coming from the district to families. It can be overwhelming. But it's all very important. So probably the two important things that we want to make sure every family is clear on is which cohort is your child in? Are they a Monday, Tuesday, or a Thursday, Friday? Because we don't want everyone showing up on Monday, you know, the concerns of that. So I think that mailer will be very important for that, but we'll also couple it with information about when is the bus going to pick up your child? When is it going to bring them home? What's the stop? You normally get that information at the start of each year, and we will make sure every family has that. What's also great is mailing is not going to be it. We will still use the phone dialer system. We'll still use your email. So please make sure that's updated in the parent portal. I think somebody on here said they're having trouble getting in the parent portal. If that's the case, again, on our website, we've got the technology help desk line to call so that you can get into that parent portal. If we need to reset your password, our team in our customer relations office can help you with that. get into that parent portal, make sure we have the best information for you. I'm going to try to, when we come back, answer a few more questions, but before our hour is up, I do want to take a little bit of time because many of you submitted questions prior to the session, as part of RSVPing. And I know there were some questions just getting a sense of what this remote learning has looked like for our pre-K students, for our youngest learners, those 4-year-olds. And so Kelly Rivers is here to share a little bit of information about our pre-K program, which I always brag is one of the best in the state, and they have the 5-star Step Up to Quality rating to prove it. Kelly, share a little bit more with what things have been looking like in pre-K.
Thank you, Scott. My name is Kelly Rivers, the Director of Early Childhood Education, and we are really, really proud of the work that our youngest learners have been able to do remotely. And we'll use some of those same strategies as our students move into the blended learning model. We have some enrichment programs that we have been able to make accessible to our students. One is the Columbus Museum of Art, Ballet Met, and the Columbus Jazz Arts Group. So our desire is to expose our kids to a variety of different opportunities that will help increase their exposure to the various cultural experiences that we have in our city. We also utilize a new platform, which I'm very proud of, which is a Seesaw platform. It allows our earliest learners to have access to a very user-friendly remote system. And so students are able to submit work that is audio, video, drawings, pictures of their assignments, and our fabulous teaching staff is able to deliver instruction in that same way. They are able to provide instruction that has audio or video, so it provides a level of independence for our learners, and we look forward to seeing that level of independence move into that blended learning model when our kids return. The other thing that we have been able to provide is amazing supplies for our kids that will still be utilized in the blended learning model at home. So there'll be some hands-on activities. We know that the screen time has to be monitored for our youngest learners. And so we want to be able to provide not only our digital access, but also that necessary hands-on experience for our kids. And so each of our students in our pre-K program receive a supply bag for those hands-on activities. And finally, we are excited to announce that in November, all of our students will have access to an amazing program by Teaching and Learning Collaborative called Math Camp, and it will involve our parents. Each of our students will receive a book bag with these amazing activities to be able to do at home. Again, stressing the importance to balance both the digital experience with the hands-on experience for our earliest learners. So I'm just really excited about what we were able to do innovatively. I'm proud of our teaching staff who has been very resilient in helping to reach our youngest learners, as well as our families who've been engaging with us. It's awesome to see the engagement on our Seesaw platform. We can see our parents working with our students and also our teachers as well. So just really, really proud of what we've been able to do for our earliest learners.
Kelly, thank you so much. Again, I think the pre-K program really has had to quickly evolve into what it looks like. And I'm so glad to hear so many of our community partners have stepped up to help, to be a part of that, to really help with that engagement. Okay, friends, I'm looking at the time on the clock, and I always promise you that we try to keep this to an hour. I know that you have had a lot of questions, and I share in the understanding. I'm going to put my screen back up here a second so you can see some additional information. I understand the concerns that many of you still have. Some of the questions that you're asking, there may not be the specific answers just yet as to what the school day is going to look like. Again, as I shared with you, Dr. Dixon and the leadership team are working very closely with our with Columbus Public Health, with our teams across the district, with our labor unions, to make sure that the plan that we've put in place is done safely and it's done right. And I liked what someone on here said. They said, we're also worried about teachers and staff. So are we. We are worried about first and foremost our students, but also making sure that our teachers and staff are safe. And so those are why, the plans that are being implemented, the additional training that's in place. And somebody asked, well, why are we doing this? First and foremost, we know that our young people, for the majority, learn best when they are in that classroom, when there's direct interaction with our incredible teachers. And so we want to try to get to that model that we know is most important for that continued growth and development of our young people. We have asked so much of our families to make accommodations at home, to have that learning environment at home, to quickly become computer experts to help their young people. But we know that in-person learning is so impactful, it is so important. And yes, it does try to get us back to normal. But again, we're going to make sure that we're doing it right and we're doing it safe. And that is why, again, I feel like I'm a broken record in saying about working closely with our health experts. But it's true. They are working so closely because we want to make sure to do this right. Let me touch upon a couple of things I saw in the chat before we end tonight's session. Somebody commented about diversity. They commented on the importance of making sure that plans work for as many of our families as possible, and that we are reaching all of our families, no matter the language or situations at home. So I can tell you that the same information that we're sharing with you, we're going to be working to also share with our families that where English is not the primary language at home. We have a large immigrant and new American population in our community. So we're going to be working very closely with one of our partners. I think they're even on our session tonight, our partners at ETSS, who will help make sure that we are reaching as many of our families as possible in the languages that they speak so that they can understand this process. Because as I said, I know there's a lot there. We're also reaching out to, our families that are at the homeless shelters where, where they've been learning have been changing. Somebody also really stressed the importance of transparency, and I couldn't agree more, which is why we started these virtual family engagement sessions in the first place. We would love it if nothing else would change, that the numbers would stay where they were at, that what we know about COVID, what we know now is what we'll always know, that everything would stay the same, but we know that things change. The plans that we create, we wish that we could keep them just as they are because nothing was going to change, but we know plans also have to change. But what we've tried to do with these sessions is continue a conversation so that at least as things are changing, you have an opportunity to share the information that you've been sharing, that we're able to kind of share with you where the district is at right now, recognizing that things change. By the end of this week, some of what we've talked about tonight may change, but at least you've been armed with some information as to where the district is right now. And as we end, this is where I'm going to ask for your help. You've heard information, and some of you even said, I've heard this before, I've read this before. That's great. I wish that in our district of 50,000 students, that all of our families felt that they had this information already, and that this was simply just a reiteration. But we know not all of our families are connected and as engaged. They may have different schedules that didn't permit them to be a part of this. They may have different situations at home that didn't permit them to be a part of this. Please, the information that you've gleaned from tonight, the information that you've gathered from online, I hope you continue to share that with the other families that you know. If you're one of our community partners, that you share that with the families you serve. If you're one of our staff, teachers, part of our district, that share this information with as many families that you know, because that's how this conversation works best. I truly believe that if we want our students to be successful, then we need to make sure that their families feel supported, that the families feel engaged, that the families are successful as well. That's how we best help our students reach that opportunity of success. So as the clock reaches 7, I do want to thank all of you for being a part of tonight's session. There was a question about recording the session. Yes, we record the session and we do post it online. I think somebody also asked about the chat. If that's something that you would like more on, please feel free to email me. Or you can also, and I think all of you would have gotten the RSVP that has my email address as well as our Engage email address. So please continue to feel free to contact me directly, and we'll continue to share information, because again, this is a conversation. It doesn't end here at 7 o'clock. And we hope to continue it again on Thursday and throughout the school year. So thank you everybody for participating. Have a good weekend, or excuse me, a good evening and a good week. And we hope to continue this conversation soon. Thank you, everybody. Have a good night.